When a patient chooses to receive bedside delivery of their discharge medications as part of his or her overall treatment plan, the discharge prescriptions are filled and delivered to the bedside prior to the patient leaving the hospital and at no additional cost. Members of the on-site pharmacy team work side by side with doctors and nurses to coordinate all of a patient's discharge medication needs, including prior authorizations, dosing questions, payment concerns, and education regarding their treatment plan. This interaction is essential to reaching the desired outcome for the patient. Almost 70% of adverse events post-discharge are medication related. This is not surprising because 60% of discharged patients are not compliant with their medication plan. They simply do not fill their prescriptions, or they fill them but do not take them properly. This alone results in almost $200 billion in annual cost to the healthcare industry. By engaging patients at the point of care, gaps in the medication plan can be identified and addressed during the discharge process. We can ensure the patient has their prescribed medications and is fully educated on the importance of being compliant to their treatment plan. Through the ExchangePoint platform, we have delivered more than 50,000 discharge medications to the bedside and have engaged patients in thousands of consultations. In hospitals that utilize ExchangePoint, patients who receive their discharge medications at the bedside were readmitted at a rate of 7 to 9% less than those who did not. For those patients who also had a bedside consultation with a pharmacist, the reduction in readmission was at a rate of 8 to 11% less than those not engaged in the process. ExchangePoint provides integrated workflow management of a meds-to-beds program, bedside consultation, and a pharmacy-led medication reconciliation. The solution is uniquely designed to identify and target at-risk patients at the time of admission, operationalize meds-to-beds program workflow, and provide work lists to serve as a monitoring and documentation platform for the pharmacy team. A RX Guide provides a medication regimen summary for patients, making discharge instructions easy to understand. By utilizing ExchangePoint, patients can head home after discharge with no additional stop at an outside pharmacy and no lingering questions about prescribed medications. ExchangePoint is proactive, targeted, integrated, strategic, and results-driven. These elements combine so patients can experience complete care the way it's meant to be.